My name is Kwabna Chencheheni. Many thanks for joining us here on News Today. To our first story, these are an inhabitants of the Bongo and Kasana West districts of the Upper East region are being sensitized on using ideas that are familiar within their local environment to promote water sanitation. The Water Sanitation and Hygiene for Public Health program is being undertaken by Center for Indigenous Knowledge and Organizational Development in collaboration with Water Aid Ghana. Upper East correspondent Albert Sori has more.
The Center for Indigenous Knowledge and Organizational Development, in collaboration with Water Aid Ghana, organized a training program on indigenous development for participants drawn from the Bongo and Kasina West District Assemblies, as well as staff working on the Water Sanitation and Hygiene for Public Health program. The aim of the workshop was to train the participants to be able to identify already existing local institutions and strengthen them with local resources to be able to promote water sanitation as a way to improve public health at the community level. This way, the indigents adapt faster without new ideas being imposed on them. The program, dubbed Wash for Public Health, saw participants embark on field trips to interact with community members in order to be able to implement what they learned from the workshop. Wilberforce Latte is head of programs for Southern Sector at the Center for Indigenous Knowledge and Organizational Development.
After a long while in the development arena, we realize that nothing much is changing. I think what is changing are the persons of the people who are involved in the development work. And we realized that this was so because we didn't try to find out how communities were already doing their own thing, and supporting their own internal processes. We try to kind of impose our ideas on them. And most of the time, it doesn't work. And when it doesn't work, we think that they are backward. They are not interested in their own development. And that's why, as an organization, we are promoting endogenous development. That kind of development that recognizes their internal knowledge systems and support them to build on that one.
Participants of the workshop were confident they would be able to use what they learned to make an impact at their various communities.
We are in this training to learn about the indigenous development approaches, which are the CIM, that is Community Institution and Action Plan, and also talking about community vision. And we use that knowledge to go to the community to catalyze to bring the best in them. And in building it, we use that to go towards at the base of the WASH. And WASH is Water Sanitation and Hygiene Management. So this helps me to know a lot about the community, most especially the CIM training.
Communities have become, for some time now, have become used to direct benefits or interventions from organizations, NGOs, I mean. With the vision and the action plan and that as a tool in the ED approach, communities will better understand their own process and then be able to carry out their agenda effectively. And I think we have to be up and doing and supporting the communities in that direction so that everything that we are doing will not be our own, but it will be owned by the communities.
The workshop we learned about indigenous development, that is development from within. And it is not only development from within, but then the external development being added from what is within, and then the community grows. I'm going to the community, and as a community development officer, I allow the community to lead me and tell me whatever resources that exist in their community, and they are the same people that will lead me, and then we discover, we come about with the plan and the activities and whatever we will do to be able to achieve some of the things in the community.
Elham Mumuni is the Women Empowerment Manager for the Center for Indigenous Knowledge and Organizational Development. She believes that women groups are critical in tackling water sanitation and public health.
My role in all of this is to identify in communities the economic activities that they are already carrying out, and then how those activities can help to address their WASH issues. building on their local knowledge and then local institutions, and then bearing in mind also that these communities have been resilient for a very long time, which means that they have some knowledges, they have some institutions that have been holding them on for this long. So my interest is to identify these institutions they work, especially with women groups and the kind of economic activities they do. And then based on that, help them acquire or build their own household latrines to address their wash issues.
Albert Sori's report for Joy News.
Now, the partnership between the Japan International Corporation and the Upper West Directorate of the Ghana Health Service will come to an end next month. The 10-year partnership saw the government of Ghana and JICA construct over 100 community-based planning, health and services compounds and went ahead to provide standard medical equipment to all the compounds. Acting Upper West Regional Director of the Ghana Health Service, Dr. Winfred Ofosu, at the final dissemination forum on the Ghana Health Service JICA project stated that the construction and provision of CHIPS compounds has led to a high reduction in neonatal mortality rates in the country. Rafiq Salam has more in the following report.
Ghana Health Services in 2006 adopted the Community Health Planning and Services CHIPS compounds concept by the Japan International Cooperation Agency, JICA, as a national strategy for promoting accessible, quality and equitable services to all Ghanaians, particularly those in rural areas. JICA provided a total of $4.8 million for the first phase of the program, which started in 2006 and ended in 2010. Even though a lot of progress was made in the first phase, JICA and the government of Ghana believed that there was still room for improvement. The second phase of the program started with the construction of more CHIPS compounds and the provision of standard equipment for all the constructed compounds. Acting Upper West Regional Director of the Ghana Health Service, Dr. Winfred Ofosu, touted the achievement of the program, which is slated to end next month.
The regional institutional maternal mortality ratio declined from 212 per 100,000 live births in 2010 to 155.8 per 100,000 live births in 2015. As at the end of June 2016, it has declined further to 105 per 100,000 live births. Similarly, the regional institutional neonatal mortality rate declined from 11.2 per 1,000 live births in 2011 to 7.4 per 1,000 live births in 2015. Stillbirth rate also declined from 25.3 per 100,000 live births in 2010 to 15.8 per 1,000 live births in 2015.
Upper West Regional Minister Amin Amidu Suleimani thanked the people of Japan for the many interventions in the region, especially in the area of healthcare delivery.
Government on this part will continue to prioritize healthcare, especially in our rural areas where access to health facility is difficult. I know as stakeholders, before this forum comes to an end, you would have learned some lessons and good practices that will inform you on how to improve upon health care delivery in your various communities.
A representative of JICA, Masanori Yamazaki, was pleased with the 10-year stint of their work in the Upper West region and hope the region will continue to build and share its experiences with the rest of the country towards the attainment of universal health service delivery. Reporting for Joy News, Rafiq Salam. Wow.
Well, the Ministry of Health says it has released an amount of 1.5 million Ghana cedis to 3 psychiatric hospitals in the country. The release comes as the Accra Psychiatric Hospital says it has been compelled to halt new admissions over debts the hospital owes its food suppliers. Join us, Maxwell Agbagba has more in the following report. The hospital has been in the news for weeks over a 4.2 million Ghana cedi debt it owed its food and medical suppliers. The inadequate food and medical supply pose danger to staff of the hospital as they do not have enough to cater for the inmates. A member of the hospital's communication team, Emmanuel Fibri, says the premier psychiatric hospital has been running on donations. He indicated the 1.6 million Ghana cedis the Ministry of Health promised the hospital is yet to hit the accounts.
Just as you've rightly put it, we were here when the Honorable Minister came around with his team and went on and gave us those assurances that looking at the impact the financial situation actually having on us, he's going to ensure that they work things out immediately, so we'll get some funds running. But we're hoping, as he said, immediately they will bring the money to us. And it's over a week now that we've not gotten the money yet.
In a sharp rebuttal, however, the Ministry of Health says it has disbursed an amount of 1.5 million Ghana cedis to 3 psychiatric hospitals in the country. This was revealed by the Public Relations Officer of the Ministry, Tony Goodman.
I'm aware we've sent 1.5 million actually to the Mental Health Authority to be sent to the psychiatric hospitals across the country. The 3 actually, as I speak to you, the money has actually gone to the various accounts units. So it's not true that they have not received the money. Maybe at the time you were talking to the communication team, they did not cross-check their facts before commenting on the same issue. So I believe that will be a miscommunication gap on the part of the communication team. We have actually sent the money.
In a related development, some nurses at the hospital are worried over delays in the payment of their salary arrears. The Controller and Accountant General's Department in October last year released a little over 700,000 Ghana cedis as payment for outstanding salary arrears owed some striking psychiatric nurses. 10 months after that monies were released, some psychiatric nurses are yet to receive their arrears. Agnes McDogbey is one of the affected nurses.
Some of my colleagues have been paid, but mine and some are not yet in. Basically, they pick them at random. That is how it happens. So my forms wasn't picked. Until date, it has not been paid. Another form came in that we should fill it and then they'll start processing it. That was around in October. We did the same thing and then send it to them. Yet so the money is not yet in. They are supposed to pay money in 9 months. Basically, it's very difficult. You know, living in Accra here is very, very difficult because the hospital is not providing you with any transportation, accommodation. Everything depends on you. So with the money not coming in, it's not helping. You have to borrow money from banks, from your family, and we are of age. You can't go to your family for money. I want money to go to work. I want money to feed. It's not fair.
The Health Ministry PRO Tony Goodman, however, says government is doing everything possible to make sure the outstanding arrears are paid.
You submit the supporting document to your account session. It goes to the agency. The agency will bring it to Ministry of Health, who will send to Finance. Finance take the same to Ministry of Auditor General. Auditor General will finish, submit it back to Finance. Finance will submit it back to us, and then we will now inform the institution. So you can see clearly that it's not 2 or 4 days or 1 month issue. And clearly, you are not dealing with 4 or 5 people. Thousands of names, because you are dealing with promotion, you are dealing with new entrants as well. So that will happen. It's not as if somebody is working and is not being paid anyway. But let me use this opportunity to also appeal to any body who actually has suffered anything because he or she has not been paid these arrears, that we are working to make sure that this arrears is paid. We just waiting for the various institutions to finish their auditing process and verification and submit the document for us to pay.
Maxwell Agbagba reporting for Joy News. You're watching News Today here on your Journey channel on Multi TV. Also available on your Go TV channel 144 and your DSTV channel 421. Still ahead, the question remains as to whether or not your vote is going to be determined based on the things you see on social media from the various political parties and indeed their candidates. We'll bring you those answers right after these messages. Stay with us. Many thanks for staying here on News Today. To some more stories now. And the Ashanti Regional Police Command has arrested 54 suspected armed robbers after 2 were killed in a gun battle yesterday. 4 others have also been declared wanted. My colleague Kofi Asante is at a media briefing being organized by the police service in Kumasi, and he's joining me on phone now with a lot more. So, Kofi, can you tell us more about this very issue you speak of?
Well, as I speak with you, the police has ended a briefing on the issue of arresting 54 individuals suspected to be armed robbers and involving in various robbery incidences in the region. They are aged between 15 and 32. In fact, many of them are just at the age of 15, 19, and 25, just about 6 of them who are above 25 years of age. And these individuals, 54, according to the police, are directly involved or linked to various robbery incidences which has led to death of some police personnel and other public officials. For example, one at Siyase Continental, where an agric officer was killed in his house, as well as a police officer who was recently killed at a hotel near Kumasi, then Chamosu to be precise. The Deputy Regional Police Commander, Mr. Ampofuluku, addressing the media, revealed that these individuals were picked up from their various hideouts. And in fact, the police over the period have been monitoring their activities. It will be recorded that just last month, some robbery incidents took place at the Bomso, a bakery shop, where 2 of the attendants were shot. The police are saying that these individuals who were picked, some of them were directly involved. And yesterday, they had encounter with them, and 2 of them were killed. According to the police, they are going to screen out these, and those who are offenders will be processed to court.
Kofi Asante, many thanks for that update, and as our correspondent in the Ashanti region, bringing us up to speed with that very information from the Ghana Police Service. Well, they're saying that they've arrested 54 persons. They'll be screening them in a bit, and then they'll be ensuring that a lot more security updates are taken care of in the Ashanti regional capital, Kumasi. But from the Ashanti region, let's now head to the Western region, the oil city. And President John Dramani Mahama, we are told, has arrived at Takoradi, the oil city and Western regional capital. Correspondent Kweku Usope is on tour with the president and joins us on the phone now with a lot more. So, Kweku, good afternoon. Many thanks for joining us. Kweku, if you can hear me, what's the purpose of the president's visit and what has he been saying so far?
The president's visit just started, and it's just a campaign tour of the region to also drum home his message of development and a better agenda for Ghanaians. So it just started. He got to the airport a while ago and is now at Aguna Nkwanta, where he's going to address the chief and people there and party faithful.
Beyond that, what more is he expected to do, and how long is he even supposed to stay in the region?
Okay, so the president from Ahanta West and Aguna precisely will go to Axim, where he will be part of the National Fisheries Derby. Amongst the issues to be talked about at Axim include matters regarding the fisheries activities, like outboard motor supplies and how farmers, fishermen can acquire them, and also premix fuel distribution and the premix committees, landing beach issues will all come to the fore at the place. They will also be talking about how to understand that the re-asphalting of roads in Axim and all of that are government projects and not so much to do with the propaganda that is being spread around by some other parties that they are all oil proceeds from oil companies that have been donated to the state. Apart from that, he'll go to at Chieko in the Mpoho district and run through to Elubo and to Jomoro district and come back to Takoradi, where he would be part of the first oil celebration from the 10 project.
Kweko, many thanks for that update. And that was Kweko Superpower, our Western regional correspondent, bringing us a lot more from the president's visit to the region. Well, indeed, he has begun campaigning. We'll bring you a lot more on that on our news and news analysis program, The Pulse, which airs at 3 p.m. right here on your Joy News channel. And also, even before that, at 2:30 p.m., there's the election brief. We'll bring you a lot more from the president's visit to the Western regional capital, Takoradi. Still staying with politics, and this time around, let's try and merge it with social media, because you do know that social media has over time become a haven for many. It is a place where people share fun stories, sad moments, and even now starts and promotes agenda. Following its relevance, various politicians and indeed political parties in Ghana have now adopted the medium to reach out to an expectant electorate, with the two leading parties in the country obviously leading the pack. But how relevant is social media to the political discourse here in Ghana? For instance, will polls conducted on social media have any influence on who you vote for come December?
It depends on who says it at that moment. It might be that, you know, we have party people. They are also on social media. They see what's there, they just type A, B. But then the ordinary people or the floating voters, sometimes when they see these things, they don't bother about it. They just, because I saw one and then I didn't even type A or B. I just bypassed.
Is it really relevant in the first place?
Oh, it's relevant. It's relevant. One way or the other, it might have an influence, but I don't think it really has impact on the elections. But because I will not vote based on what social media is telling me, but I'll vote based on the policies.
I don't think it's relevant as such, but people can be allowed to express their opinions.
Does it reflect the reality on the ground?
It could, but you know, a lot of things go into elections. Yes, one can even decide who to vote for on the voting day.
Would you be influenced by something like that?
No. I can't be influenced by somebody's thoughts and conjectures. Yeah, I know I vote based on issues, not personalities or where I come from, person's appearance and all those things. I don't take them into consideration.
It's relevant, but it depends on the individual, whether to show cause that I like this, I don't like that. Yeah.
But do you think that it reflects the reality on the ground?
Well, to some extent, but taking into consideration the total population, yeah, I don't think they've covered much of the populace, so I don't think it's a fair reflection of the population.
But would you, as a person, be influenced by a social media poll to vote for person A or person B?
I will not at all. Because I've already made my mind where to vote for, who to vote for. So.
Actually, it doesn't reflect the minds of the people. It doesn't reflect it. Why? Because we vote based on policies, government policies. You see, whatever you think right is what you think government is doing. If government is not doing well, there's the need that you change government. You understand? That is how it should be.
So the social media polls do not reflect the reality on the ground. But do you think it's relevant? And would you, as a person, be forced or be influenced by a social media poll to vote for person A or person B?
I wouldn't be influenced. Why? I wouldn't be influenced. Let whatever anybody puts out there doesn't reflect the reality on the ground. So for me, it doesn't have any influence on me.
Well, quite interesting there. But those are the views of some persons on the streets of Accra. I don't know what you think, but well, let's keep the conversation going.